Okay, so like I said, I sorry I got interrupted. I know I kind of briefly met one of the people on this call here, and we can definitely do some more discussion later. But tonight's talk is everything you need to know about back pain, and I'm so glad that you joined us today for this seminar. Have there been any news flashes on chiropractic care that anybody has seen? You bet. There's actually revolutionary methods that are used by chiropractors that make the news. The big question is whether or not you miss them. So these important news flashes can make a big difference in people's life, especially if you have back pain. So while I go over them, I want you to ask yourself whether these announcements might benefit you. The first news flash is from a research paper that was published back in 2010. And what they found is that chiropractors are able to totally eliminate back inflammation and back pain. So when you have back pain, you often feel the inflammation in your back that causes all the pain. It feels tight, hot, and swollen. These are three signs that there really is inflammation in your back. Now, intuitively, you know that if you can decrease the inflammation, your back pain will go away. Scientists in Canada, in this research paper, this was published in the Journal of Chiropractic Medicine, like I said, in September of 2010. And what they did is they found a way to take away the inflammation, and that was with chiropractic manipulation of the spine. In their 2010 study, they allowed some of the 21 volunteers that they had for this study, the ones with back pain, to get 9 chiropractic visits that included chiropractic manipulation of the spine. Those without back pain were considered the control group. So what these smart scientists did is they also monitored the level of inflammatory compounds in the body called interleukin-6, or IL-6, and C-reactive protein. And that may be familiar to you. They also measure C-reactive protein in diabetes because diabetes causes systemic inflammation. So you would expect that those who have back pain have higher levels of IL-6 and C-reactive protein than those who didn't have back pain. And that's exactly what they found. But it was the next finding that was really the most important. What they found is that the subjects with back pain who received the 9 chiropractic adjustments had IL-6 levels and C-reactive protein levels return to their normal levels after their adjustments, plus their back pain went away. Now, newsflash number 2 is new chiropractic method restores disc height in elderly with disc herniation. If you ever knew anybody who had a disc herniation, you know the misery they're in. They can't move much at all. They can't get out of bed or into bed, and they have trouble sleeping because of the pain. Many times they can't lift their legs to get into the shower or can't stand up straight, and they can barely drive a car in some cases. Now, in the case of cervical herniations, they may actually lose the strength in one or both of their arms. Now, this has actually happened to me in 1996. I actually herniated my C5, C6, and C6, C7 discs. I literally lost 95% of the strength in my left arm extensors in just 24 hours. I went from being able to bench press more than 350 pounds to not being able to open a door that had an automatic closer on it or turn my car to the left with my left arm due to the loss in strength in my triceps. And the pain, it was truly excruciating. So when I talk about these things, I'm coming from a place of real true understanding of what people are going through. So when there's a herniated disc, be it in the cervical spine or the neck or the lumbar spine, the low back, the person may experience not only localized pain, but pain, numbness, tingling, and weakness, or any combination of these into the affected extremity. Now, needless to say, marriages can be troubled, especially if the condition continues for a very long time, and it often does. Many marriages have ended up in divorce because of the financial devastation that can arise when the spouse with the disc herniation can't work anymore because of their back condition. Now, normal medical treatment clearly doesn't work for disc herniation. Prescription pain medications only decrease the pain, but they do nothing for the healing of the condition. And there's another problem with prescription pain medications that we aren't even really going to get a lot into, and that's how addicting they can be. And the horrible thing about the addiction, especially if they're using opiates as painkillers, is that the recovery programs that people go to, they actually put them on medications that are even worse than the addictive medication that started it. So opiates, when they're prescribed for pain control, it can really be a downward spiral. So the answer, instead, is to get to the root of the problem and to eliminate it so that healing can actually occur. Now, medical doctors had a hunch that chiropractic would work, which is really interesting because a lot of people are familiar with the fact that a lot of medical doctors, a lot of old school medical doctors, didn't really believe in chiropractic, or they tried to dissuade people from using it. New medical doctors, people who are coming out of school, really understand now the integrated approach of using chiropractic along with medical care. So this study that I'm talking about, this actually was in the Biomed Central Musculoskeletal Disorders Journal in July of 2010. And in 2010, somehow news reporters overlooked what I think was one of the biggest stories of the decade. This was new advancements in chiropractic that include a method called non-surgical decompression that restores the height of the disc to what it was before the disc herniation. Scientists at the University of California in San Francisco in the anesthesiology department took a big chance by thinking outside the medical box and decided to study non-surgical decompression in patients with low back disc herniations. Medical professionals have their own type of decompression that's done under anesthesia in surgery, and obviously they have really serious risk to them and to the patients, but non-surgical decompression that's used in chiropractic actually has no serious or adverse risks at all. The scientists and doctors at the university examined the clinical records of 30 patients, 21 females and 9 males, who were all around 65 years old. They were generally overweight. They had low back pain for about 3 months due to the disc herniation, and the patients had recorded their low back pain recorded their low back pain scores based on a scale of 0 to 10. On average, they rated their pain at a 6.2, which starts to get into the severe pain category. Now, on that scale, 0 is no pain at all, and 10 is the most unbearable pain that one can imagine. There was also a record of the height of the lumbar disc, so they did this via MRI, if I recall, and once the disc heights start decreasing, the two vertebrae actually start getting close to each other, so this is an important measure to take. And this decreases the amount of room that the exiting nerve root has, and this can then cause pain, amongst all the other symptoms that I already mentioned. The disc herniation patients received non-surgical spinal decompression therapy for 6 weeks with more than one treatment per week. This chiropractic method uses a computer to set up the traction of the spine, followed by a programmed rest cycle, where the traction is decreased for several seconds, and then it's begun again, followed by another cycle of rest. And this process eventually sets up a vacuum effect in the spine, sort of sucking that disc material back into the disc itself and out of the spinal cord canal. The treatments are about 15 minutes long, and they generally don't cause pain. Now, this is actually how we treated my herniation back in 1996, just strictly through spinal decompression and chiropractic care. The medical doctors that did this study were absolutely amazed at the results from chiropractic. The scientists found that the non-surgical spinal decompression decreased the patient's pain levels from 6.2 all the way down to a 1.6, which is very little pain, pain at all. Their disc heights increased from 7.5 millimeters to 8.8 millimeters, showing a restoration in disc height. The patient's increase in disc height was directly correlated with their reduction in pain. So wow, I mean, this is really great news for those who have disc herniations. And you may not know it, but non-surgical spinal decompression methods are also used for cases of spinal stenosis. And in this condition, calcifications on the spinal vertebra that are affecting the movement of the vertebra, as well as impinging on the nerves of the spine, causes pain from the compression of the sciatic nerve or other nerves of the body, depending on where those herniations occur. Or, I'm sorry, in this particular case, the calcification, the extra calcification of the vertebra. Compression of those nerves cause very annoying symptoms, some of which can be the pain that we talked about, and sometimes it's associated with numbness or tingling, such as you might feel in the buttocks, legs, or feet. It can cause strange sensations such as the feeling of ants crawling on your skin or heat or cold. The pain may also be a sharp shooting pain that makes life very difficult. However, there have been cases of people diagnosed with spinal stenosis who have been told that they need surgery and opted for non-surgical spinal decompression instead, and they never needed the surgery at all. So tell someone, anyone that you know about non-surgical spinal decompression helping heal spinal problems when they truly believe that they didn't have any answer except for surgery for decades. Now, just for the record, in my office I do manual decompression, which is a little bit different than what was done in this study. This is a piece of equipment that I will eventually add to my office. It's something that I've wanted to add since I've been in practice, but the particular machine I want is very expensive, and so I haven't actually purchased one yet. However, if the computerized decompression is something that you or someone you know wants to try, then by all means let me know. I will help you find an office that does offer the computerized spinal decompression. I know that there are a couple offices here in Kansas City that do. So the next news flash that we're going to talk about is chiropractic increasing the quality of life in disabled Marine Corps veterans. Some of the injuries that veterans sustain are ones that affect their life permanently, and that decreases their mobility. It causes severe back pain, can disable them, ruining chances to work or have a normal life. This particular study was a case study that was in the Journal of Chiropractic Medicine in September of 2009. And in this study, they were looking at a 43-year-old Marine Corps veteran from Buffalo, New York, who went to a chiropractic clinic to see if they could possibly get some relief for his back symptoms. The man was experiencing numbness and tingling in his right lower leg radiating from his back. During military duty, he had sustained an injury to his back that left him with problems with his lumbar spine. Specifically, his fourth lumbar vertebra had herniated quite remarkably, and the disc space between the fourth and fifth lumbar vertebra was narrowed. They also found parts of multiple vertebrae that had been fractured. So the chiropractors at New York Chiropractic College treated that veteran with 10 chiropractic treatments of his low back over the course of 2 months. And they used a chiropractic table called a flexion distraction table, which I do use in my office. That's what I use for manual decompression, plus other methods of manipulation, and worked with him on how to change the way he moved and the way he exercised. And this is what is generally called conservative treatment for low back pain. The veteran had 25% less low back pain after the 8 weeks and a reduction in disability of 22% for his low back pain. These are based on outcomes assessment measures. And this is pretty significant considering how much pain he had been in for several years. If treatment was allowed to continue, that veteran likely would have experienced greater pain reduction and return to function. Now, the interesting thing, at least something that I think was fantastic about this, is this study in part spurred the formation of the Patriot Project. And this is a grassroots movement to help supply chiropractic care to all active military and their families. While the addition of chiropractic into the VA system is coming, it's been a really slow process. They started this process before I started chiropractic school way back in 1995. And so many chiropractors across the country are helping to bring that care directly to military bases across the country and all over the world, including the FOB, the forward operating bases in Afghanistan and Iraq. I was introduced to this project in January by Shiloh Harris, who was an injured veteran from the Army. It's an amazing project. If you wanted to, you can check it out at www.patriot-project.org. It's an amazing, amazing movement. So, if you missed any of these news flashes on back pain, it's entirely possible that you did, but you don't have to miss out on the benefits of chiropractic. So all of these news flashes really go to show you that research has really been supporting what chiropractic has already been saying for decades. So we're going to go over a couple frequently asked questions about chiropractic and back pain. The first thing, the first question is what is back pain? And back pain is just that. It's pain in the back, usually the low back or the neck, that may last for a short time or several weeks, oftentimes caused by inflammation or mechanical changes in how the back's moving. Now, back pain generally is categorized as acute or chronic depending on how long it lasts. If it's a short time, it's called acute pain, and if it lasts a long time, it's called chronic. So generally, back pain that lasts for more than 90 days is called chronic back pain. Now, what causes that back pain? Back pain may be caused by an injury or trauma, such as damage from a car accident, or by a disease that's occurring within the body that attacks the vertebra, nerves, or the spinal cord itself. So, for example, an injury at work or home where you slip and fall may cause a back problem such as a fracture or a muscular sprain. A car accident may cause direct injuries to the spine or cause sprains, strains, disc herniations, and fractured vertebra. And back pain may also cause sciatica or other radiculopathies, which is nerve pain that results after the nerve is compressed and extends out into the arms or legs. Poor posture can also cause back pain, as well as sleeping on an old mattress or sitting in a really bad chair can cause back pain that interferes with your sleep. Diseases may also contribute to back pain. Those may or may not benefit from chiropractic care. But for example, osteoporosis, which causes brittle bones, can be associated with spinal vertebral fractures as well as loss of disc height. And those can cause a lot of pain. Now, osteoarthritis actually can be helped by chiropractic. Arthritis may eat away at the bones of the spine or cause extra calcifications that limit movement. We talked about stenosis a few minutes ago, and that can cause pain. And then there are other neurological disorders that may cause the nerves to fire uncontrollably, go numb, or be exceptionally painful, or make you feel radiating symptoms or even cold and hot sensations. So sometimes some of those kind of sensations can be caused by things like diabetes, muscular dystrophy. I'm spacing off. I just drew a blank on the other disease process that I was thinking of. Now, the next thing that people wonder is, why are they so stiff when they have back pain? And back pain often comes along with stiffness, and it makes it difficult to move and makes your job and daily life hard. The reason why your muscles get stiff is because they're trying to protect your spine from further damage. It's very common for those with disc herniations to have muscular stiffness. However, a chiropractic adjustment of the spine, which aligns the vertebra and stimulates healing to begin, muscle stiffness actually starts to resolve itself. So why can't you get out of bed or reach your toes from back pain? And it's the same sort of issue. When you have that spinal condition and your muscles are guarding your motions, you won't be able to move like you do normally. And this is why your motions are slower during activities such as getting out of bed, touching your toes, turning to the left and right, or bending to the side or forward. Chiropractic adjustments of the spine align those vertebrae and stimulate that healing. So once this muscle stiffness begins to resolve itself, you'll actually be able to move your body in all of these ways. Now, of course, one of the things that almost everybody asks is, am I going to be like this forever, especially if they've been dealing with back pain for a long time? Chiropractic is a method of healing that directly affects the spine and the nervous system, which controls the whole body. And like most injuries and pain, it will go away with proper treatment. The key word being proper treatment. There's a saying that I heard that I like, and it's that sometimes the hardest thing about being a patient is being patient. You can only speed up the healing process so much. So without the use of drugs, which can actually increase the healing time, even though they make you feel better, chiropractic can actually help to decrease the healing time to a minimum, especially when certain nutritional guidelines are followed as well. And any of you who may be on this call that have seen me following a severe injury know exactly what I'm talking about, because I talk about some of those things in my office. And not only that, having taken the ChiroTrust pledge, I have taken a vow that I'm going to get people better as quickly as possible, keeping it as affordable and short as I can. The pain really will go away. Now, how do we diagnose back pain? Our office is well qualified and able to make a diagnosis for your low back pain. We start by taking a complete medical history and a physical exam. And during the physical exam, you're going to be asked about how the back pain started, where it is, how severe it is, how long you've had it, what makes it better or worse, and to explain times when you've had that same type of pain before. We're going to do an examination of your spine, which is going to include a scan of your feet to be able to see how the foundation of your body is actually acting. We're going to be doing a postural, orthopedic, and the neurological examination of the spine. And if we need extra imaging tests to rule out more serious types of spinal conditions, we'll use those. And some of those studies might include x-rays, CT scans, MRIs, myelograms, bone scans, or ultrasound. Blood tests can also sometimes provide us some insight to your condition if those are more involved disease processes. So how will your back pain be treated? Your treatment for low back pain will always depend on your condition and how long you've had it, as well as how severe the pain is. So a chiropractor uses non-invasive types of treatment that are aimed at healing your body in many ways. And some of these methods include chiropractic manipulation, which may be done via direct hand contact or by hand adjusting. They may use chiropractic tools like an impulse tool, which I sometimes use in my office, or equipment used by our office, such as a flexion distraction table. We also may use physical therapy and exercises, where we design a physical therapy program or an exercise program for you to re-strengthen or relearn how to use the muscles that are weak and contributing to your condition. Hot or cold packs may be used to decrease inflammation or help improve your mobility. Massage also can be used, and we have a massage therapist in our office, Chaz Armstrong. He is super fantastic, and what massage does is increase the circulation to the muscles and tissues and help flush out the waste products that have remained for far too long. Massage techniques may be used to melt knots found in the muscles that are limiting movement, interferes with the blood flow, and causes pain. Massage also is great at relieving or improving your mood and your sense of well-being. And then last but not least is nutritional therapy and supplementation. And although we don't use this to a large extent, we may often recommend that you eat certain foods that accelerate healing and stop eating other foods that are slowing down your healing. And these recommendations are based on the latest nutritional studies. Certain herbs and vitamins, mineral supplementation such as antioxidants and anti-inflammatory herbs may be suggested because of their ability to be able to decrease that inflammation in the body and stimulate healing. So if you were told you need surgery, should you give chiropractic a try? I recommend that you at least schedule a visit and talk to me or talk to another chiropractor. I generally go through an approach with my patients. I say, try chiropractic first, drugs second, and surgery last. If you've tried chiropractic, and then we've tried chiropractic in conjunction with some of the different medications that are on the market, and neither of those work, then surgery is an option. But in many cases, our office can help fill in the gap of healing that's not filled by modern medicine, and that may result in healing so that surgery is not necessary. Every case is very different, but many people have found success with chiropractic. Chiropractic is a drugless method of healing, uses all natural methods of pain control. Chiropractic care dates back to the beginning of time. In fact, Hippocrates, who is the father of medicine, wrote in his textbooks, "Get knowledge of the spine, for it's the requisite for many diseases." In the U.S., chiropractic treatments began in the late 1800s and has been continued to this day for one major reason, and that's that it works. People know it works no matter where it fits in the general medical paradigm. So if you didn't catch anything that we went over here this evening, watch our website at www.myperformancechiropractic.com. I'm going to post this talk in both our event videos tab at the top of the landing page as well as my blog section of my website. And I'll also link to it on our Facebook page at Performance Chiropractic-Olathe. It should be there in the next couple days, so you'll be able to listen to this again if you need to, or if you know somebody else who's suffering from back pain that wasn't able to listen in, you can have them listen to it, and they can make a decision whether they want to come and talk to me. Also, feel free to email me, and I can send you any other information that you may need or anything that I can do to help you, and I can be emailed at info@myperformancechiropractic.com. So if you haven't made your first appointment for chiropractic care yet, please accept my invitation to do so. Not only will we help you get healthier, but we'll have fun informational events every month that we'll sure you love. Just call our office at 913-782-5000 and mention that you listened to our back pain teleseminar, and if you don't have insurance, we'll take care of your first visit for only $39. I really hope that you enjoyed this seminar, and we're going to be back in September with our next teleseminar. Normally we have these every month, but our next event that we're going to be doing in the office is actually going to be an in-office workshop called Pack for Your Back. We're going to be doing that here in the office on August 18th at 6:30 p.m. And during this workshop, we're going to invite all of our parents and grandparents to bring their school-age children in with their school backpacks. And we're going to go over how to wear them and pack them so that they keep their packs safe during the upcoming and future school years. So we look forward to seeing you again then, and I hope that everybody enjoyed this and has a great evening.